Today, we're going to be discussing isolation precautions and its prevalence in the hospital. Isolation precautions create barriers between people and germs. These precautions help prevent the spread of germs and bacteria in the hospital, which protects both the patient and the healthcare providers like doctors and nurses. There are different types of isolation precautions, such as contact precautions, droplet precautions, and airborne precautions.
One of the resources used to identify more universal isolation precautions is the Center for Disease Control, or CDC, webpage dedicated to this topic. There are multiple points that address the requirements of healthcare settings, and we have summarized them here. To begin, necessary protective equipment must be readily available for all members of staff when having to come into contact with an infectious patient, or one that is under investigation, and/or their belongings. This includes the physicians, nurses, technicians, and housekeeping staff. Everyone should be protected. Gloves, masks, gowns, and eye shields should be accessible, as well as hand hygiene materials like hand sanitizer and a place to wash your hands. Because staying informed is so important, the education team should keep their staff updated on new protocols and research findings, as well as address any incompetencies noted. The purpose of isolation is to keep the patient from infecting others. Therefore, they should be kept in a single room. In some cases, there should be a triage plan in place when there are not enough single rooms for all infective patients. Visitation policies should also be continually revised as to not further cut off the patients from their loved ones, but to ensure that they are kept safe throughout their hospital stay. It is part of the nurse's role to obtain any crucial medical information from the patient upon admission, and should therefore be able to ascertain any possible exposures to infectious diseases. Vaccination history and medical history should be obtained, and further investigated if the patient has any risks of contacts with infectious agents, such as methicillin-resistant Staphylococcus aureus or MRSA, vancomycin-resistant Enterococcus or VRE, Clostridium difficile, etc. Proper cleaning methods of isolation rooms and patient equipment should also be enforced, with the help of housekeeping staff, Trudy equipment, and sterile wipes.
At St. Peter's University Hospital, isolation precautions are extremely prevalent and carefully followed by the healthcare providers and staff. Prior to admission, in order to ensure the safety of the workforce and other patients in the unit, incoming patients at the emergency department are held and tested for infectious agents before being admitted and transferred to that specific unit. Every patient is now tested for COVID-19, while additional testing may be done for those who have a history of MRSA, a C. diff infection, or a vancomycin-resistant enterococci, otherwise known as VRE. But the precautions don't stop there. During their stay at the hospital, if the test from the ED was positive for any of the infectious diseases, such as MRSA or C. diff, protocols are put into place and they are isolated from the other patients and given a single room. Depending on the type of infection, certain precautions with color-coding indicators, as well as the proper PPE that are necessary to enter the room, are placed outside of the patient's door. For example, if a patient is in contact precautions, a red contact precaution sign along with disposable gloves and gowns will be placed by the entrance of the patient's room. That way, if anyone needs to go inside the patient's room, such as nurses, doctors, or any other staff, they can properly don the necessary PPE before entering.
Let's talk about hand hygiene and its role in isolation precautions. In general, the practice of hand hygiene is extremely important upon entering and leaving a patient's room, regardless if they are on isolation precautions.
But when a patient is on isolation precautions, it's imperative that the nurse washes their hand with soap and water rather than just hand sanitizer in order to fully cleanse the hands. Even then, there's a right way to do it and a wrong way. Let's take a look.
You can see in this example, she's only rinsing her hands and not even fully drying them. This is definitely the improper form of hand hygiene. Now in this video, you can see she rinses her hands quickly before applying antibacterial soap. Then she's very deliberate about scrubbing every surface on her hands between the fingers and under her nails for at least 20 seconds. After that is done, be sure to rinse it all off and dry it off with an air dryer or a hand towel. Before entering a patient's room with isolation precautions, it's important to know what PPE is involved and the order of putting it on. There's the gown, face mask, goggles, and gloves.
Start by removing the gloves, pinching one glove and dragging it down. Now with the ungloved hand, hook your fingers on the inside to be sure not to touch the outside of the glove and remove the second glove. When taking off the gown, using clean hands, grab the inside of the gown and pull it away from your body, ripping the collar. Slowly remove your arms and be sure not to touch the outside of the gown. Pull the gown away from you one last time to rip the band around the waist and begin to fold the dirty gown for disposal. Again, being sure to only touch the part of the gown that was against your body. Next, perform hand hygiene before removing any further gear, such as your eye shield, N95 mask, or regular face mask. The N95 mask should be removed by pulling the bottom strap over your head, followed by the top strap. Regular face masks can be removed just by removing the loops from your ears. Be sure to never touch the front of your mask. Wash your hands again, and you are good to go.
We are now going to discuss providing care for patients who are in isolation. When a nurse has a busy day, they may not want to be stuck, per se, in a patient's room with their gowns and any other gear on. It just may seem like too much. However, as we've learned and discussed the quality and safety education for nurses' competencies, patient-centered care is one of the pillars of the nurse's role. We serve as advocates for our patients, their connection to their care, and they deserve to have a say in their needs. They also deserve our full attention and respect, no matter what their condition is. Two attitudes emphasized by the CUSIP competency is to value seeing healthcare situations through patients' eyes and respect and encourage individual expression of patient values, preferences, and expressed needs. We have to take the time out of our day to listen to our patients and advocate for the best healthcare possible for them.
Knock, knock, knock. Hey, can I come in?
Hi, I'm a little bit busy right now.
Well, you know what? All of us have jobs that we have to do, and you're one of my patients. I'm gonna come in and check in on you. Can I get you anything?
No, because I told you that I don't need anything.
Excuse me.
Oh, would you mind wearing a mask? I just feel a bit safer.
I don't really like masks. I kind of read on a website that you're not really supposed to wear a mask. It's bad for your mental health and your third eye and things like that. So I don't really like wearing masks.
Yeah, I mean, I guess since you're here, I was gonna ask you, can my sister come? I've been feeling a little bit isolated.
You have tuberculosis. I don't really think your sister should be coming in here.
Even if I'm feeling like isolated, lonely, I haven't seen anyone in a while.
What do you expect? You got a communicable disease able to give to people. You just gotta be on your own for a little. I'm here. We're here together.
Yeah, I didn't want you to think I'm busy.
Oh, I don't know what to tell you. Your sister really can't come in here. But do you want anything? Pain medicine? Nothing?
No, like I said, I'm busy. I don't really need anything right now.
Alright, well, I'm not gonna be back for another 3 hours. I got other patients to deal with, so I'm just gonna get out of here. Alright, I hope you don't have a lot of pain with your coughing up blood situation.
Alright.
Alright. Thanks.
Bye.
Alright, bye.
In this video example of what not to do in the patient care setting, we get to see what the nurse is doing wrong. She's not listening to her patient's needs and is instead prioritizing her own agenda over her patient's. She's not wearing any sort of PPE, not even a mask in an airborne precaution room. The patient verbalizes their discomfort with the nurse not being geared, but she simply ignores her. The patient also states that she would rather her nurse come back at a later time, but because the nurse is so busy, she cannot adhere to that request. Sometimes that happens, but the manner in which she approached the situation was obviously very rude. In accordance to research published in the Journal of Clinical Microbiology and Infection, patients have expressed feelings of distress, alienation, or being a burden to healthcare staff, and confusion related to isolation precautions. The patient is almost shamed for her condition, and when she asks whether or not her family member can visit, the nurse berates her for even suggesting that she wants to get her sister sick, when that is not the case. Although visitation policies may vary, there are options that minimize the mental isolation felt by a patient who is left to be sick in a room all day all by themselves. The nurse also states that if the patient does not need anything now, she will not be back for 3 hours. This coincides with a study done revealing that healthcare workers' behavior towards isolation precautions resulted in significantly fewer bedside visits, shorter contact time, and less frequent patient examinations. For some patients, such as those with tuberculosis, those 3 hours can be crucial, and yet the patient will be left all alone. This interaction is obviously an exaggeration, but it is not uncommon to see some healthcare workers afraid of exposure, which is a normal fear, but with proper education and implementation of safety precautions, it should never interfere with providing good health care to patients. Let's see what could be done differently in this situation.
Hi, I'm Amy. I'm going to be your nurse for today. I know earlier you were busy, but is it alright with you if I administer your pain medication now?
Yeah, I'm not doing anything right now. Thanks for respecting my time.
Okay, and before I do that, is there anything else that you need from me today?
I was wondering if my sister could come visit me. I'm feeling kind of isolated.
Yeah, we can arrange something for that. We can check what the visiting hours are and ensure that she has the proper PPE for her so that when she comes in, both of you are safe.
Yeah. I'm also glad that you're wearing the proper PPE around me. That makes me feel safe with the community.
Of course.
Now that's a lot better. In that second situation, we can see that the nurse was respectful of the patient's time, condition, and needs. Even though the patient was on isolation precautions, the nurse made sure to try to accommodate their requests where arrangements were made to check for visiting hours and ensuring that the proper PPE for any guests would be available. The nurse also made sure to wear all the proper gear necessary when entering the patient's room, which is exactly what should be done upon entering a room with isolation precautions. A study conducted in 2016 found that nurses generally have good compliance with isolation precautions. More specifically, this research was based on scales composed of hand hygiene and use of gloves, environmental infection control, worker and patient safety, and way of contagion. The mean scale of these scores show that nurses working in intensive care units were higher than the nurses working in clinics. This shows just how important it is to follow isolation precautions in the hospital setting to protect both the patient and yourself as the nurse.